Lisa Mosconi, The XX Brain. Dive into the essential takeaways from The XX Brain, a groundbreaking book by Lisa Mosconi, which sheds light on the inherent inequality in the medical field that leaves women's health in crisis. The author presents the crucial differences between women's and men's bodies and how the wrong understanding in the medical world has led to misdiagnosis and improper treatment. Discover the importance of addressing women's health beyond just their reproductive organs and how hormones play a significant role in brain health. This summary will help you understand the importance of not only prioritizing women's health, but also in striving for equality in the medical field.
Women's health in crisis. Women's health is at risk due to inequality, bias, and lack of research in the medical field. The historical dominance of men in medicine has resulted in a lack of understanding of the differences between men and women's bodies. This has led to misdiagnosis, harmful doses of medicine, and overlooking the unique needs of women's health, including the brain. Women are twice as likely to experience depression, 4 times as many migraines, and 3 times more at risk of autoimmune diseases. Moreover, 2 out of 3 Alzheimer's patients are women. Therefore, addressing women's health is an equality issue and should be treated with the same urgency as a natural disaster. Hormonal transitions and brain health. Hormones such as estrogen play a significant role in brain health. Menopause can cause a rapid drop in estrogen levels, leading to depression, anxiety, and an increased risk of heart disease, obesity, and diabetes, as well as Alzheimer's disease. However, with effective strategies, these effects can be managed to maintain brain health. If you've experienced premenstrual syndrome, PMS, you're likely aware of the significant impact hormones have on the body. However, the degree to which hormones affect the brain may surprise you. Estrogen, for instance, is known as the master regulator, influencing essential brain functions. It aids in energy production, cell health, and spurs activity in the regions of the brain that handle attention and memory, among other functions. Estrogen helps to protect the brain by enhancing the immune system and stimulating the release of endorphins, which keeps mood stable. However, when women undergo menopause and their estrogen levels plummet, it can be devastating. The most significant takeaway from this discussion is that hormonal changes, particularly during menopause, can significantly affect brain health. Menopause typically occurs when a woman has her final menstrual period and is no longer fertile, typically in her 40s or 50s. Women who have had a hysterectomy will experience menopause sooner. In addition to common symptoms like hot flashes, the sudden drop in estrogen can also impact a woman's mental health. Many women experience anxiety, depression, and sometimes schizophrenic or bipolar disorder symptoms. In addition, menopause can exacerbate the risk of heart disease, obesity, and diabetes. Research shows that estrogen's brain activity declines as estrogen levels drop, while amyloid plaques, linked to Alzheimer's, increase. Memory centers of the brain also shrink, increasing the dementia risk for 80% of women. Although Alzheimer's symptoms may only become apparent in later life, the disease is the result of an extended period of time. Menopause is often when Alzheimer's begins in many women. The solution to these problems is simple: learn about the implications of hormonal transitions and how to address them correctly. With the appropriate preventive measures, menopause's effects can be managed, allowing for continued brain health. Debunking the myths of Alzheimer's in women. Women are not predetermined to get Alzheimer's due to genetic predisposition, and the disease is preventable if women adopt healthy lifestyles and diets. The misconceptions surrounding women's health are plenty, and the author brings attention to Alzheimer's disease and the various myths attributed to it. One of the most common myths is that only women carry a special Alzheimer's gene and are predetermined to get the disease. However, it's not true, as Alzheimer's is usually preventable, and only a rare genetic mutation contributes to 1 to 2% of Alzheimer's cases. Women's ethnicity, on the other hand, can make them more susceptible to Alzheimer's. If you're a Black or Hispanic woman, you are twice or 1.5 times more likely to develop the disease, respectively. But a genetic predisposition is not the only determining factor, and 1/3 of Alzheimer's cases can be prevented by adopting a healthy lifestyle and diet. Another myth asserts that Alzheimer's is common in women because they live longer than men. This assertion is a misconception, as women only live 3 to 5 years longer than men on average, and they usually suffer from the disease at a younger age than men. Women are not more susceptible to age-related diseases other than Alzheimer's, indicating the need to investigate what's causing the Alzheimer's epidemic. In conclusion, society needs to change the perception that Alzheimer's is a natural disease or predetermined in women. Instead, more emphasis should be placed on adopting a healthy lifestyle and diet to prevent Alzheimer's disease. Understanding Alzheimer's risk factors. Alzheimer's risk factors go beyond genetics and can stem from lifestyle, environment, and health. Tailored treatments using precision medicine can help improve your odds. If you think having certain risk factors for Alzheimer's means you're destined for the disease, think again. Just like being dealt a winning hand of cards in poker doesn't guarantee a win, having risk factors for Alzheimer's doesn't automatically mean you'll develop the disease. Instead, these risk factors are merely flags to keep an eye on and manage. Thanks to the advancements of precision medicine, treatments can now be tailored to individual specific needs, regardless of whether they have certain risk factors or not. The key message is to take stock of your overall health to evaluate your risk of developing brain disease. Looking at your genetic makeup, environment, and lifestyle is a good starting point to determine your Alzheimer's risk. Are you obese? Do you have a heart condition or diabetes? These are all risk factors to consider. Traumatic brain injuries, toxic chemicals in your environment, and smoking are also potential risk factors. It's important to note that while considering these risk factors may be daunting, it doesn't mean you're destined to develop Alzheimer's. Instead, being proactive in managing your health and asking your doctor to do a full physical and test for various health factors like cholesterol, blood pressure, and infections can help you understand your risk and be forearmed in the fight against Alzheimer's. Menopause hormone therapy in Alzheimer's, a controversial treatment. We put immense trust in the pharmaceutical industry to find cures for various medical conditions, including Alzheimer's. Unfortunately, Alzheimer's medications have a high rate of failure in clinical trials, especially for women whose unique experiences have been often ignored in medical research. Menopause hormone therapy, MHT, has emerged as a potential solution for Alzheimer's, as it replaces estrogen and progesterone that might aggravate the disease after menopause. However, MHT is controversial due to its risks of stroke, blood clots, cancer, and dementia, as found by a clinical trial that examined the effects of MHT on 160,000 women. Nonetheless, the trial had flaws as it only tested women in their 60s and 70s and focused on long-term use of high-dose MHT, leaving doubts about the effectiveness and safety of MHT for other groups. Despite the concerns, smaller studies have shown promising results for short-term use of low-dose MHT in women below 60 years and 5 years into menopause. Additionally, MHTs have been shown to decrease heart disease risk and improve brain health in women who had hysterectomies. Ultimately, the decision to take MHT should be discussed with a doctor who can weigh up the possible benefits and risks based on personal risk factors. Therefore, MHT remains a controversial treatment for Alzheimer's, despite its potential benefits. Optimize your brain health. What you eat affects your brain directly. Eating a balanced and nutritious diet is the key to optimizing your brain health. No extreme diet is healthy for your brain. Focus on eating high-quality food instead. Eating unsaturated fats found in avocados, nuts, and fish helps your heart and brain flourish. Complex carbs like those found in vegetables, brown rice, and quinoa are high in fiber and balance estrogen and sugar levels in your bloodstream. Eating prebiotics like onions, bananas, and garlic, and probiotics found in food like yogurt optimizes the good bacteria in your gut. If you need extra support, check your level of B vitamins and omega-3 fatty acids, which are essential for your mental, emotional well-being, and brain health. The importance of low-intensity exercises for brain health. The idea of exercising might be daunting for some, but doing regular low to moderate intensity exercises can have enormous benefits for overall health, particularly for brain health. Exercise releases growth hormones that help repair and build new connections in neurons, reducing the risk of developing dementia later in life. Women's bodies thrive on regular low-intensity exercises, and the intensity and length of exercise should be adjusted based on age. For women in their 20s and 30s, a mix of aerobic exercises for 45 minutes, 3 times a week, can help slow down the aging process, while postmenopausal women are advised to increase the frequency but lower the intensity of their exercise routine to 30 minutes, 5 times a week. High-intensity workouts could increase inflammation, muscle and joint problems, affect sleep quality, and damage muscles and bones in older women. Try doing yoga, Pilates, gardening, or a half-hour bike ride as daily and mundane exercises that offer long-lasting benefits for the brain and overall health. Tackling the stress epidemic. Women, whose lives demand constant juggling of multiple responsibilities, suffer the most from the negative effects of stress on the brain, making it necessary to control stress levels. Chronic stress can lead to depression, poor sleep, and brain shrinkage. To reduce stress, we need to take digital detoxes, practice meditation or mindfulness, and improve sleep quality. This can be achieved by limiting phone usage and checking work emails outside work hours, creating relaxing wind-down periods before bed, and using melatonin supplements and eating melatonin-rich foods like pistachios. Boost your brain health. Intellectual stimulation is the key to a healthy brain, according to studies that reveal the benefits of stepping out of your comfort zone or pursuing an interesting job or degree. Women, who have had fewer such opportunities in the past, have other offline ways to boost their brain, like reading newspapers and books, watching theater, documentaries, playing board games, and learning new skills like playing the violin, which affects the brain's versatility, resilience, and response to stimuli. The earlier you start giving your brain these challenges, the better your chances of taking control of your brain health.
In conclusion, The XX Brain, by Lisa Mosconi emphasizes the need to address the inequality in the medical field that puts women's health at risk. By understanding the inherent differences in women's and men's bodies, the medical establishment can offer proper diagnoses and treatments to women. The book also emphasizes the importance of women's brain health and the significance of hormones, particularly during menopause. By raising awareness and making proactive lifestyle choices, women can manage their health effectively. Moreover, by adopting a balanced, nutritious diet, regular low-intensity exercises, stress management, and engaging in intellectual stimulation, women can take charge of their health and contribute to resolving the healthcare crises faced by women worldwide.